Total joint replacement is a relatively new technology that's basically come about in the last 50 years that enables us to replace, resurface joints that have become damaged either through wear or trauma. In short, it enables us to take patients that would normally progress to a cane or a walker and get them back out and moving and doing, in many ways, most of the activities that they would be enjoying had their joints not become worn out. The most common patient that needs a total joint replacement is someone that's worn out their joint, and there are a variety of reasons that can happen. It's probably a combination of wear and tear, and then maybe either an anatomic or hereditary predisposition. The majority of patients that need joint replacement are in their late 50s through 70s or 80s. Some patients have put up with a joint that's worn out for many years and finally have gotten to the place where their mobility is so restricted that they have to get it replaced. Other people are quite active and maybe younger but want to maintain that level of activity. Most patients, if they're having a hip or knee replacement, are forgetting to walk or cane in the corner by 4 to 6 weeks. And usually by 12 weeks, they're back to almost all of their daily activities. And it does keep improving for up to and sometimes over a year. I think one of the things that's unique about Kootenai Health is that it's a community-owned hospital. Community members can have input and should have input into their care and have had input. So a lot of what we do at the hospital, many of the things have been impacted by patient suggestions. First thing you need to find is a surgeon that you trust. A surgeon that is operating a facility that has an organized program is really going to be able to do their job much better. And a surgeon that doesn't have the support necessary to do their job effectively and well. I feel fortunate to get to work at Kootenai Health and fortunate to get to operate at a hospital that has really made a commitment to their community to provide the very best services, the very best post-operative care and operative care.